so this is good for her. I usually try to measure with my arm and then just come down so that you're not having the patient move back and forth, especially if they have some mobility problems. So the ear that you're testing is the one you're turning the head to. So if I want to test her left ear, I'm turning her head to the left. If I want to test her right ear, I'm turning her head to the right. Okay? So sometimes if they're anxious, I'll actually get on the table and show them what I'm going to do. But usually an explanation is okay. I'm going to turn your head to the left. We're going to come back kind of quickly. I'm going to give you something to focus on. Just try to keep your eyes open. That's important. If you don't see the nystagmus, then you can't really diagnose it. And then I'll give you something. I'll walk you through the rest of the maneuver. Okay? So I'm turning her head to the left. And then we're going to come down kind of quickly on the count of 3. 1, 2, 3. She comes down. I'm totally supporting her head when my hand is almost behind the occiput and the ear there. So I have her head in my hands. You're looking for the nystagmus. You're also asking her to tell you if she's having any dizziness, any symptoms. Look for any central nervous system signs. Are you having any tingling or numbness on the side of the face? Keep them talking so you can hear if they're slurring their vision, or slurring their words. Anything here? No. This one? No. Okay, so then she has no symptoms. I'm not seeing any nystagmus. Then you're just going to sit her back up. Granted, that might be hard. Have her tell you if you have any symptoms here when you sit them back up. Look at their eyes here. Make sure there's no rebound nystagmus or anything like that. Then I'm going to test her other side. And it's a 50-50 chance to get the right one on the first try, but turn. 1, 2, 3, come right down.
Now the room is spinning.
So she's telling me the room's spinning. If it's the most common type of BPPV, it's going to be posterior. What kind of nystagmus are you going to see here? If it's posterior. Is it upbeat or downbeat? Upbeat, and it should be rotational towards the ear that's down, so it'll be a right rotational.
You're going to see these on videos.
Yeah. And then it should stop. And in like 30 seconds, I say most of them stop within 10, 15 seconds. If it keeps going, then you got to think of something else.
Okay, stop.
So it's stopped. I'm going to keep her there for about a minute, and then now we'll go right into the canal repositioning maneuver. So if we get them down, we don't sit them back up and say, oh, you have BPPV, we're going to put you back down and roll them back over, because it's just a lot for the patient to handle. So after a minute goes by, I'm going to extend her neck just slightly more. So this is where we talked about horizontal canal.
Yeah, remember I said PT-induced horizontal canal litholysis?
And you don't want to bring them up and rotate them, because then it's going to go right into the canal. So I almost extend them more and rotate them over to the other side. Then here you're asking the same questions. Are you getting any room spinning dizziness? You're looking at their eyes. They shouldn't really have anything here. Some people might get a little bit of dizziness.
Nothing.
Okay, minute here. Then you're going to ask them to roll onto their left side. You're going to have them put their chin towards their left shoulder, so they're tucking their chin in and looking down towards the ground. So it's going to be like one smooth movement here. So you're going to roll over onto your left side. Their chin's tucked in towards their shoulder. We'll do this the opposite way too, so you guys can see. So at this point, that's kind of dumped the crystals out. Now you got to get them into sitting. So I usually leave them here about 30 seconds, but you can just do the minute rule for everything. So if you're unsure, just minute for everything. And then you have them swing their legs off, and then you're slowly sitting them up, and you're holding on, because sometimes they can get like a reset where they're pushed backwards. They can totally lose control of their posture, so you really want to keep your hands really on their shoulders. You okay?
Yep.
Then you get them into a chair that's their feet can be on the ground, but they can hold on. All right, so we'll do that one more time. So that
Controlling the head is